Good afternoon, sir. I am suffering from ED. My periscope test says total cardiovascular risk grade mild with mild arterial stiffness. How many months it will take to be normal, and what type of medications it will be helpful? So see, now there is arterial stiffness. Arterial stiffness, mild arterial stiffness means this is early stage of vascular damage. Now you have to find out what is causing this. In the previous question I said, see, smoking, alcohol, diabetes, hypertension, high cholesterol, high homocysteine, vitamin D deficiency, vitamin B12 deficiency, thyroid abnormalities. These are the things which will cause damage to the blood vessels and which will cause arterial stiffness. So now your treatment depends on identifying the cause and treating that. There is no general medication to just relax the blood vessels. Generally, L-arginine will help if you take in long term. But if you treat the underlying cause, it will take around 2 to 3 months to get sorted out. But in 3 months time, if your stiffness is not coming down, then you may need shockwave therapy. So one more question. After pepaverine being administered, the shaft of the penis became erect and very strong, but the tip of the penis, that is glans of the penis, remained very soft. Is it a problem? What is the cause and the remedy for this underlying problem? See, now penile blood vessels, they start at the base of the penis and they reach the tip of the penis. So if your penile Doppler is normal but tip is soft, maybe your blood vessels in the tip are not healthy, or the blood flow into the penis is not strong enough to make the tip stronger. But for regular intercourse, even if tip is soft and the shaft is hard, you can have intercourse. But anyway, do the basic evaluation, that will tell us why the shaft is soft. So now coming to other question, does Kegel exercise cure mild venous leakage completely? See, Kegel's exercise may not cure your venous leakage. See, Kegel's exercise will improve the strength of the pelvic floor muscles. So venous leakage is different, pelvic floor weakness is different. So if your venous leakage, or if you are losing erection because of the loose pelvic floor, then Kegel's exercise will help. But if your pelvic floor muscle is tight, but it's because of pure venous leakage, then Kegel's exercise may not help your venous leakage. So one more question. What is pelvic steel syndrome and its remedy? Make a video on this. Okay, definitely we'll make a video on this. One more question, sir. I have drinking and gutka from 13 years. My age is 48. My testosterone level is 288. I have ED problem. If I change my lifestyle, will I improve? See, definitely taking tobacco or smoking for long term, that will affect LH hormone in the testis, LH production in the brain, so which in turn causes low testosterone. Sometimes the testicular tissue itself is damaged because of the long term tobacco intake, whether it is smoking or gutka. So now and long term smoking can also damage your penile blood vessels. So now some amount of damage will be there, but once you stop, some recovery will be there, but whether it will be 100% recovery or 80% recovery or 60% recovery, we can't say. Only penile Doppler study and periscope test will tell us how much of the penile vascularity is damaged. So based on that, we can actually tell you what will be your recovery chances. In penile Doppler, if blood flow is good, that means your recovery chance is very good. But anyway, gutka and alcohol, smoking, all these are not good for your heart, not good for your lungs. So it's better to stop. How many months will take to, okay. So generally, you will see improvement after 3 months of stopping smoking and alcohol. It takes minimum of 3 months. Sometimes you might have to take some testosterone boosters, whether it is natural testosterone booster. Anyway, we made a video on how to increase testosterone naturally. You follow that and try to boost your testosterone levels. Or otherwise, since your age is 48, you are not into fertility age group, you can take some medications which boost your testosterone. So at least maintain your testosterone level around 350 for your age group.